Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How effective is Litfulo for alopecia? About 1 in 4 patients will see hair regrowth covering at least 80% of their scalp within 6 months of taking Litfulo daily. Around 13% of patients taking Litfulo will have at least 90% of scalp coverage after 24 weeks. At 12 months, about 45% of patients taking Litfulo will have at least 80% scalp coverage, and this number increases to about 61% of patients at 24 months. Around 80% of patients who had at least 80% scalp coverage after 12 months of taking Litfulo daily maintain this response through 24 months. Litfulo Trial AAIIn. In a randomized, double-blind, placebo-controlled trial, Litfulo was studied in patients with alopecia areata. The primary endpoint was severity of alopecia tool, SALT, score 20 or less at week 24. This is a tool researchers use to assess scalp hair loss. Scores range from 0, no scalp hair loss, to 100, total scalp hair loss. After 24 weeks of taking Litfulo 50 mg daily, 23% of patients achieved a SALT score of 20 or less. This means these patients had scalp hair loss of 20% or less, they had at least 80% of scalp hair coverage. This was compared to 1.6% of patients in the placebo group. How long does it take Litfulo to work? Litfulo starts working soon after taking a dose. However, it may take at least 4 weeks before you notice the effects of Litfulo. Some people taking Litfulo during clinical studies had 80% of scalp coverage within 4 months. Litfulo works by blocking immune cells that cause hair loss in people with alopecia areata. This allows hair to regrow, which takes time. Hair on the scalp grows slowly, 0.35 mm/day, or 1 cm/month. It is important to take Litfulo daily so it can continue working to allow your hair to grow back. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.